Okay, next, and our last one, Anthony Ellertson, Associate Professor, Web and Digital Media Development Program, Department of Computing and New Media Technologies, UW-Stevens Point. The topic, development of digital tools for patient care at UW-Stevens Point in collaboration with BayCare Clinic and mZeal LLC.
I'm going to talk about two projects that I've had the great privilege of working with John and Weiss on over the last year. The first one, which started last June, and then the second one, which is just kind of going in this last October, which is with BayCare and the inpatient system. And a little bit more background on myself. I specialize in mobile development and game development, and so kind of from these things come the systems that we're looking at working on. The first project that we have is basically a suite of tools to help two different kinds of industries that are related. And these come out of my own experiences. I'm the parent of a 7-year-old boy with autism. And so what we are in the process of doing is creating a suite of applications that help deliver autism therapy services in a more productive and fine-tuned way to the children that are out there. It's kind of an interesting problem because of of course, the increase in the incidence of autism, and then also the fact that increasingly now states are mandating coverage or care for children with autism. It's created a sort of a crisis in that industry, and that they have to hire basically a lot of therapists to meet the needs. And in the past, they were able to train those therapists over a long period of time, and that, of course, they've seen a lot of stress on. And so the first set of apps basically uses artificial intelligence engines and cloud services with devices like these to basically begin to track the data and record things that are happening to make suggestions on the kinds of therapeutic approaches that therapists can take. And we're especially looking at how to get the sort of implicit knowledge that is inside senior therapists or people who've been doing this for many years, get that into the artificial intelligence engine, have it look at the patterns that are there, and then be able to kind of feedback in real time to new line therapists who are working with these children to give them up-to-date and specific information about, hey, what's the best approach to kind of take with this child. We're also using a variety of cloud services in terms of video for us to basically create tools that help refine integrated reliability for the therapy teams as well. And this is kind of bleeding into another project where it's a related industry, but a different issue in terms of communicative disorders, which unfortunately doesn't have as much funding. And what we're trying to do is basically create a set of tools based on these same ideas to help speech pathologists and others in the field deliver services into schools using kind of the same idea, but at a much cheaper delivery rate than what's currently being done. So that's kind of the first one. And then what was also talked about was this is the project that we've just begun here in October. And this is to work with BayCare Clinic, also using an artificial intelligence engine to sort of smartly think through what is that check-in process like, or to create let's say, a better way of bringing people into the hospital or the clinic, and to get them towards the places that they need to go with the least amount of effort as possible. So again, using devices like these, we can basically know when someone has come into the building, what they're there for, who they are. We can automatically begin to, using the artificial intelligence engine rules, we can begin to deduce things about them, such as if they have a seeing impairment, we can begin to we can present information in a way that it's easier for them to digest. Or if we have someone who is in a wheelchair, we can immediately start to show them things like where the restroom is, the handicap restroom, get them again smoothly to these various areas of the clinic that they need to be. And kind of create that sort of an automated process that helps them and the clinic move people through in a way that is efficient and also very human friendly.